assessing your thorax and lungs. Therefore, I will be touching certain parts of your chest and back. That is to examine the current state of your respiratory system as well as your breathing and prevent any possible heart problems. Is that okay with you, sir? Okay, so ask you, do you have any history of respiratory problems before, such as asthma or any allergies? Okay, do you smoke, sir? Okay, how about, do you take any medication recently, sir, or right now? Okay, so do you have any current problems, such as swelling, coughs, wheezing, or pain? Okay, sir. Sir, to begin with our assessment, can you kindly wear this gown so that I can examine your posterior thorax? Okay, sir. So I'm going to inspect your shape and symmetry of the thorax from posterior and lateral views. Sir, can you sit comfortably, breast out? Okay, sir. Okay. Okay, sir. Okay. So upon inspecting, sir, I see that the color of the skin is consistent with the rest of the body. Okay, so from a lateral position, observe the three normal curvatures, which is the cervical, thoracic, and lumbar. So for the cervical, which consists of 7 bones, the C1, and then the C7. The next one is the thoracic, which consists of 12 bones, the T1 to T12. And then the last one, which is the lumbar, which consists of 5 bones, which is the L1 and the L5. To assess for lateral deviation of the spine, observe the standing client from the rear and have the client to bend forward. Sir, can you kindly bend forward? Sir? So as I inspect, I can see that there are no lateral deviation of spine. Okay, sir? So sir, now I'm going to palpate for your chest expansion. So can you please take a deep breath again? Alright, so now I'm going to percuss the intercostal spaces. Now I'm going to percuss the intercostal spaces. Okay, sir, next is I'm going to palpate for your fromitus using the ball or ulnar edge of one hand. So I'm going to remove the gloves to assess for symmetry and intensity of the vibration. So kindly say 99 as you feel my hand. Now I'm going to palpate for chest expansion. So can you please take a deep breath. Okay. Sir, so now I'm going to percuss the coastal spaces. Going to check for voice sound over the chest wall. So can you please say 99, sir, as you feel my hand on your back. Okay.
99.
Okay. 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 Yes, sir. Okay, good. Okay, sir, so can you now turn around, sir? Okay, sir, so I'm just going to observe the movement of the chest. Can you kindly inhale? Exhale, sir. Okay, so I can see a normal breathing pattern, a good posture, color is even and consistent with color of face, and the chest is symmetric. And also respiration are relaxed, effortless, and quiet. Sir, I'm going to palpate for tenderness and sensation as well as tension or masses. Okay, sir, allow me to touch your chest so that I can auscultate. I palpate for fromitus. Kindly say 99 as you feel my hands.
99.
Okay, sir.
99. 99.
The fromitus symmetric bilaterally and is prominent between scapulae and had diminished as it progressed down. Now for the chest expansion. So my thumb was moving outward in symmetric fashion for the midline, which is normal. Now, sir, I am going to percuss for tone above the clavicles and then the intercostal spaces across and down. So, sir, I'm going to percuss na. Now I'm going to auscultate for anterior breath sound, adventitious sound, and voice sound. Okay, sir. So basically, the sound are all normal, indicating a good status of the lungs and respiratory system. So that includes our assessment for the thorax and lungs. If you may have any clarification of question, please just let me know so that I can refer you to our attending physician. And that's all, sir. Thank you very much. Okay, sir. So now for the breast and axillary assessment,
Don't forget to ask the patient about their history.
1, 2, 3, go. Let's assume, sir, that you already changed your clothes into the patient gown. Okay, sir. So for today, I'll be checking your breast. So I'll be inspecting and palpating your breast spot. So will it be okay, sir?
Yes.
Now, if you feel uncomfortable po during the procedure, please just let me know po.
Okay.
Okay, sir. So, is it okay, sir, if I remove your gown po?
Okay.
Arms po, both hands po. Can you raise your hands po? Okay po. Okay, next, arms on the side po. Ganito po, sir. Put your hands on your hips and then press it over. Okay, ganito po. So, next po is arm on the side. Arm on the side. Can you raise again your hand po? Ulit. Sige po po, taas. Okay, so, sir, upon inspecting the patient, okay, sir, upon inspecting your breast, it is appropriate to your age. And also, both breasts are symmetrical and there is no swelling, tenderness, and lesion are noted as well. So, the patient, your breast is color light brown. There is no obvious discoloration and the contour is convex. Okay, sir, can you kindly raise your hand again, sir? Raise. Okay, sir, now I'm going to palpate your breast. Okay, sir. When I palpate it, sir, is it painful? Okay, sir. Can you allow me to palpate your breast? Oh, is it okay? So, do you feel any pain, sir? Okay. So, upon palpation, the findings are the lymph nodes in the axillary area are non-tender and swollen. There is no complaint of pain upon palpation in the axillary area. There are no palpable nodes. The patient does not complain of pain during palpation. There is no tenderness and discharges from nipple of both breasts. Now, sir, I'm going to inspect for the areola, nipples, and axilla. Okay po. Going to inspect po. Upon inspection po, the areola is the same as the color of the skin of her breast, of his breast. One, two, go. Upon inspection po, the areola is the same as the color of your skin, and the nipples are protruding outward, and it has the same color with the areola. No swelling, no discharges, and no lesion noted as well. So, the color of your axilla is the same as the rest of your skin color, and it's covered with fine coarse hair. And there is no swelling, no tenderness, and there is no discoloration po. Sino po yung kamay niyo, sir? So, palpate ko pa yung ano. Sir. Okay, sir. So, do you feel any pain, sir? Okay po. So, okay, sir. So, we're done with the assessment of the breast. Okay, sir. If you feel any pain while doing it in your own, you can just go to the nearest hospital so that you can be able to examine by the specialist. Okay, sir. So, that's all, sir, for our assessment. Thank you very much for your cooperation. Okay, sir. So, just eat properly, enough sleep, and exercise regularly, and also drink your vitamins. That's all, sir. So,